Hi, I'm Dr. Linda Cole. I'm course coordinator for PC 713, Principles of Independent Practice. And I'm going to share with you a video that I'm recording, which will help guide you through the spreadsheets for the starting a program proposal for your Module 4 assignment. So if you're choosing to start a birth center, start a practice, or join a practice, you're in the wrong video, though you're certainly welcome to watch. But this is meant for the students who are choosing to start a program. So I'm going to screen share. And open up the spreadsheet set for starting a program. The first thing that you'll see there are a lot of tabs at the bottom. The first tab is the instruction tab, and this has a set of instructions for you about the spreadsheets. And starting out with that, your program has to be an APR and lead program, and it must include some billable visits, okay? It also talks about the different tabs within the spreadsheet, starting with the utilization and birth calculator. Now, the birth calculator is only for those full scope nurse midwifery students or nurse midwives that are in the course. The utilization tab will be used by everyone, as will all of the others. The one after utilization will be the revenue summary for year one, and then revenue summary for year two, personnel expenses, equipment worksheet, other expenses, which include your overhead expenses, and finally an operating budget, which is your final balance sheet. So you'll see lots of fields in here, lots of cells. If something doesn't apply, you don't have to put anything in it. You can just put a 0. But then you'll need to explain over in the justifications sources for what you did include, rationale for what you included, and some rationale why you didn't include certain things as well. So you'll see that as we move through the spreadsheets, there are these gray boxes that are the justification boxes, all righty? You'll need to think about all of your personnel that will be staffing your program, whether they're full-time or part-time, etc. So we'll get to that in a minute as well. So the birth calculator, again, is just for those full scope midwives. And you can be in a home birth practice or a hospital-based midwifery practice. If you're in a birth center, if you're starting a program in a birth center and you're needing to use the birth calculator, go ahead and use this one as well. So that is what that is. Now, this will populate with you putting in a number of new OB visits. It will take into consideration all of the different transfers, those patients that are ineligible for care at the beginning, etc. So it'll come out with a final number of deliveries. So let's say we had 100 in year one new OB patients and 200 in year two. You can see how the volume goes up. Part of that is that half of the clients that are coming in for their new OB visits in year one won't actually deliver until year two. So that's why that number does increase pretty dramatically. So that's how you use the birth calculator. I just wanted to show you that. And then you'll carry over these figures into the utilization page, which is what we're on now. So you'll see that there's different sections here, Section A and Section B. Section B is for the full scope nurse midwives and midwifery students. And then Section A is for all other NPs. So we're going to, for the purposes of this demonstration, we're going to use this top section, all right? So these will be all your different kinds of visit types. And then scrolling down to the bottom, whether you're an NP or a CNM, everyone will be also choosing to fill out these 3 categories: procedures, diagnostic, testing, and medications. So these 3, and then a choice of either B or A for filling in your visit types, okay? So for the purposes of time, I have gone ahead and pre-populated these spreadsheets just so we can move through them in a more timely fashion. So you'll see that I have populated some E&M visits and then other visit. So again, this is for a program. So your program may be fairly narrowly defined in terms of its population and services. So we don't expect that you'll necessarily have each of these visit types in your program. Now, some examples of some programs that students have come up with in the past are a home visit program to decrease ER admissions and ambulance rides, an open heart multidisciplinary practice within a cardiovascular office, a family planning program within a primary care office, a breastfeeding center within a birth center, and sexual assault clinic to follow up on victims of sexual assault after their initial SANE exam. So those are just some creative ideas of some programs. There are many, many more that students have come up with, but those are some, I think, really great ideas. So we want you to, again, fill out these justification boxes. Tell us in a couple sentences what your program is and who it's going to be serving. And then talk a little bit about your community data and your research in terms of the community needs and how this program will meet those community needs. How many other providers are there in the area who have a similar service that you're proposing? And then the types of office visits, et cetera, that you've chosen and how they relate to community needs. You'll also want to look at days of the year that your program will be operating and hours per day. So take into account, this may not be a full-time position. You might be spending half of your full FTE in this program, or maybe just 20% of your time. So, but it might be a full-time position for this program. So just think about that. Think about the number of days per year once you take into account continuing ed, vacation, and holiday and weekend time, and come up with that number of hours and number of days, and how many patients you'll be serving within that time frame to help you come up with your visit numbers and types. Okay, and then for year 2, why did you increase your numbers? How did you decide to project a certain percentage increase in your numbers in year 2? Now, for this demonstration, I have only filled in year 1, not year 2, just so we can move through this a little more quickly. The other thing that I have not done that you will need to do is to research your CPT codes for your different kinds of visits and populate that in this column here. All right, so let's move on to the program revenue year 1. This orange section will bring over the numbers from the utilization page. So we try to make this as easy as it can possibly be, though we know it's not an easy project, by building in some formulas for you and bringing over figures from previous pages. So hopefully that will help you. So you'll see that these numbers are populated from the utilization page, and down below as well, we have the procedures, diagnostic testing, and medications that are already filled in from the previous spreadsheet. So your charges, well, first of all, let's look at the payer mix. That's located at the top here. And again, I have just pre-populated this. Your payer mix may be vastly different from this. But I am wanting to just point out that the payer mix does need to equal 100%. If it doesn't, then your figures will be way off. So just double and triple check that to make that add up to 100%. The next thing you're going to do is you're going to need to do some research about reimbursements from Medicaid, Medicare, commercial, self-pay, or any other kind of structure that you are having in your program, payment structure. There are resources in the course. If you go to the discussions section of the course and you look at Module 4 Resources Discussion, there's a spreadsheet there with lots of links to websites that will help you in coming up with some of your calculations for these spreadsheets. So make sure that you're aware of that and making use of that resource. So from that, you should be able to determine what your Medicaid and Medicare reimbursements are for the different CPT codes that you're going to be populating. You will not find commercial rates that are published usually. So there is a resource in the discussion section about the percentage above, I think it's Medicare, that commercial will pay. So you can just use that assumption and go with that for your calculation. Now, self-pay might be the same as your charge, or you might have a discount of some sort, 10%, 20%. It's not unusual. Or you might have some sliding scale fee and take an average of that. Whatever you decide is fine as long as you put it in the justifications box so we know how you arrived at your reimbursement figures and the sources for the information that you derived. So then the last thing that you'll need to do here is to set your charge. Your charge will always be higher than your highest payer. Your highest payer is usually commercial. And so make your charge higher than your highest payer. The self-pay charge will probably be the self-pay reimbursement will be the same as the charge unless you have a discount that you apply and describe that discount. So the hierarchy of payment structure is usually that Medicaid is lowest on the totem pole, then Medicare will be above Medicaid, commercial will be higher, and self-pay will be the same as the charge unless a discount is applied. So just remember that important concept as you're working through this. And the reason that your charge is higher than your highest payer is so that a year or two down the road, you can revisit the negotiating table and negotiate for a higher payment from commercial payers. All right, so that's all been put in. And then over on the right under the revenue column, it automatically calculates your totals based on the numbers of types of visits and your charges and reimbursements, okay? So that automatically computes for you and gives you a total at the bottom. And then also the procedure revenue is added in here. And then the total of those two, the visit types and the procedures, populates here. And then you will need to do some research about your individual state because some states have a % reduction for APRN reimbursement. Oftentimes it's around 80, 85% that APRN will get paid compared to a physician. So let's say it was 85%, then the reduction would be 15%, and that's what you would put in this cell right here that then subtracts that from your total. You'll also be getting a total for your diagnostic testing and your revenue. Now, over on the right, in the utilization page, tab rather, you'll see a menu of possible procedures, diagnostic testing, and medications. So that's something that we just provide for you to look at and think about what might be used for your program, and if any. So those are there for you to choose and use. And you can add those of your own. If you think of something that's not on that list, then feel free to add it and just explain what that is and where it came from. The next tab is your personnel expenses, and this is where you will be looking at who will actually be staffing this program, what FTE portion of their time will be devoted to this program, etc. So I have populated in here a $50,000 salary for the provider. Likely that's not the provider's full-time salary, so you would need to explain over on the right-hand side in the justifications box what percentage of time is devoted to this program in terms of his or her FTE time. Same for receptionists. It's probably not the total time of the receptionist's salary. So And the receptionist might be shared by many other providers in the practice. So you need to consider those things and inform us in the justification boxes how you came up with those calculations. And same for MA or nursing support for your program. Human resources, credentialing, and administration, those are all expenses that'll be shared, I'm sure, with other providers in your practice, unless you are the sole provider in this practice. So think about that, how you're going to divvy up those salary expenses for those people who serve several providers' needs. And then the FICA tax is built in there for you to make that calculation based on your total personnel salaries. And then personnel benefits. And you may or may not have all of these. For instance, this program may not be reimbursing for professional membership or CEUs. So just keep that in mind, and things that you don't have filled in, we would expect you to explain why you're not including those over in your justifications box. The next tab is the equipment and furniture expense tab. This is where you'll figure out any kind of furniture or equipment that you need for your program. It may be that your program is in a classroom environment, and so you have to build out a classroom in your space. And so just think about that, and just choose from this. You don't have to get into great detail here about the things that you chose, but just give a general overall informative explanation of what spaces you are creating for your program and what kind of equipment you might need for that program. All righty. And then the next tab is your other expenses tab. This is where all of your overhead expenses will be reflected. It does bring over the equipment and furnishings from the previous tab, as well as the personnel expenses from that tab. So that helps you out a little bit. And then we do need you to explain how you're coming up with your calculation for rent. It may be that this program only occupies a certain square footage of the entire facility, and it only occupies that certain square footage for a certain percentage of the time that the facility operates. So think about those things and come up with a calculation. Share that with us as to how you arrived at that expense amount. Same goes for utilities. Think about your square footage that you're occupying and the time that you're occupying the space. And then you can even simply use your own home utility bill to look at your square footage for your house compared to whatever square footage you're going to be occupying in this building for this program. Telephone maintenance, housekeeping, laundry, we do give you some ideas there. Now, if you're not occupying the space in the entire time that the office is open, you're probably just going to need to allocate a very small amount maybe for housekeeping, unless you do have laundry. So feel free not to use these amounts. These are provided in other spreadsheets like the starting a practice spreadsheet. So you're just running a program, which you're probably not going to need these full amounts for these items. So you can decide what you're going to allocate to your budget. All right, then we have some client care supplies. We do provide you with a guide that you can just use $5 for the total number of visits, which again, you'll find back on the utilization page. In terms of medications, you'll need to go back to your revenue sheet and take a look at what your medications, what you're billing for your medications. And then you're going to need to do some research about the particular medications. And actually, you would do this research even before you populate your revenue for the medications. You would find out what does it cost for you to purchase these medications, because you're not going to want to lose money on medications. So, but anyway, we would expect that your expense for the medications would be less than the revenue for your medications, so that you're not losing money on the medications that you're purchasing. And office supplies, again, you can use $2 per patient visit if you would like. Comprehensive insurance is also known as slip and fall insurance. So you would certainly want that. Building and property insurance, if a building is being rented, then you don't need to have property insurance for the building itself, but you may want to have some insurance for the contents of the building, the contents that your program occupies, and the materials and things that it has. Directors and officers insurance is only if you're a nonprofit organization. I did make this a nonprofit, so I put in a little amount here. And again, you'd be sharing that with the larger office overall. So if it's a nonprofit office, then your program likely wouldn't be responsible for paying all of the directors and officers insurance, but come up with some rationale for what portion of that you are going to be allocating to your budget. And then contracted or other services includes all of these things at the bottom. And just give that some thought. You'll need to do some research. And once again, the Module 4 resources discussion is a great place for you to look for some of this information. And consulting physician, some states do require that you have a consulting physician and other states don't. So if you have supervisory language, then you probably do need a consulting physician and probably would have to pay for that. So you can do some research about that. And then finally is your operating budget summary, where you will be able to see whether you're going to make money or lose money. And so it again brings over those fields from previous tabs, and so that'll just automatically populate for you. You can see there are, at the top here, there are formulas, okay? It says program revenue year one, exclamation point, K60. So those formulas are built in, and if you find a field at some point while you're working on your spreadsheets that says hashtag ref, that means that the formula is messed up. What you can do, because you'll be making a copy of this spreadsheet when you open it up in the assignment tab, and you'll be saving that copy to your drive. And so all changes will be saved as you make them. So if you mess something up, you can just click back to a previous version of your spreadsheet and not have to go all the way back to the beginning to figure out what went wrong. So if you run into problems with formulas, you can reach out to your faculty who's assigned to your presentation group. You can reach out to IT for help with formulas, or me. So you have resources that can help you with this. So if you get stuck on something, no worries, we're here to help you. All righty. So there is a field here called uncollectible revenue. So no matter how good your billing is and your billing personnel are, there will be a certain percentage that you will not collect of what you are billing. So, you know, sometimes claims are rejected, patients don't pay their copay, etc. So We ask that you populate a number between 2 and 10 here. I've just put in 8%, and that will deduct that percentage from your total program services revenue. And then you'll have your total here. If you have any grants, donations, and loans, I did make this a nonprofit, so you certainly could apply for some grants and seek donations. But I did not factor any of those in here. But if you do that, then explain in the justifications what those grants might be and how you would go about procuring those donations. And if you have a loan amount in here, you will need to go back to the other expenses tab right here where it says business loan repayment. And you'll need to put in an annual amount based on probably monthly payments, put in an annual amount of what you'll be paying back on that loan in year 1 and year 2. Okay, so that's that. So that's the revenue, and then the expenses, again, brings that over from previous pages. And there we have that, total operating and total personnel. We have built in a 5% net margin of error. That's just kind of a safety practice, because as good as you think your accounting is, it's never going to be exactly as it is here on paper. So this just builds in a little bit of a safety net buffer into the bottom line. So that gives you a total expense of this amount here. And the revenue minus the expenses is what you come up with your bottom line, and it's either a loss or an income. And so we are coming out with a loss. It's not much, so that's good. But you might have a big loss, and that's okay. What's important is the accuracy of your projections and your resources that you use to come up with them. And it is not uncommon, and probably happens more than it does not happen, that you will have a loss in your first year, and maybe even in your second year. So you're not being evaluated here by the amount of money that you make. You're being evaluated by the accuracy of your budget. Okay, so that's it. I've shown you how to fill in year 1. Year 2 is exactly the same. We do want you to explain on this last page how you might recover your losses in the future or plan for future growth. So you may have some ideas about growing the practice, about expanding the program, about seeking other grants or some such thing as that. So that's it in a nutshell. Let us know if we can help in any way. And good luck and have fun.